Hello, everyone, and welcome to the Rotman School. I'm Brian Golden, the Sandra Rotman Chair in Health Sector Strategy here at the school, and have led our research and advisory activities for the last 22 years here, at a time when the center included just me, then joined by Rosemary, and today we have nearly 20 faculty. My comments today are a product of all of our collective work. I'm not a finance person, but a systems and behavioral scientist. But I'm going to start with a finance scenario. I'd like you to imagine first that you are a sophisticated stock investor with shares in J&J, Apple, Ford, and Pfizer, all highly research-intensive companies. All are doing well, but Apple and Pfizer announced today that they're going to cut their research budgets by 80% to distribute current dollars to their current shareholders. Some inside Apple and Pfizer make the argument that R&D is too uncertain and a bird in the hand, or dollars today, are more valuable than two in the bush or future gains. Now, what happens to Apple and Pfizer in the stock market? Investors like you begin to sell the stock short, no doubt about it. They bet on their decline because they are anticipating a decline in the expected value of these research-intensive firms. But not J&J and Ford, even though they are investing in a very uncertain world. What's happened to Apple and Pfizer in this very fictitious scenario is that they have signed on to what my former dean and colleague Roger Martin called the cult of efficiency. Systems that are designed to be ultra efficient but can't withstand unpredictable shocks, hence getting caught flat-footed without sufficient PPE, vaccine capacity, underdeveloped supply chains, too few nurses, and the list goes on. But perhaps most important, feeling proud of our efficient health system where we don't have any physicians or nurses or others sitting on their hands with extra time. No extra PPE and ventilators sitting in warehouses because we don't need them today. If you were running an auto plant at 100% utilization, you'd win an award. But even in the private sector, some leading organizations choose to over-resource and staff. Again, Roger talks about in his most recent book, Costco, where they have incredible data. They determine to the person exactly how many people they need on the floor, and then they add more. And they add more because it increases customer service. We had a shockingly high number of hospitals at 100% capacity pre-COVID, more today, and we should be embarrassed by that. The cult of efficiency. As a system researcher, I find the World Health Organization's characteristics and attributes of resilient systems to be very helpful. They are awareness, mobilization, self-regulation, integration, diversity of providing a range of services, and transformation, which I would call learning mechanisms. Let me just say a few things related to all of these and then a bit more. We in Canada and across the globe struggle with many of these attributes because we have underinvested in preparation in several domains of our health system, broadly defined. We've already heard, and I would echo this, if you look at the hardest hit by COVID, the most vulnerable, low income, inadequately housed, lacking access to primary care, that's only gotten worse since the start of COVID. This is all about the well-known social determinants of health. We need massive investments in health, not healthcare, to build resiliency. We have, in my view, an inappropriate mix of health-human resources. Physicians are critical to health systems, no doubt about it. But of course, so are other health professionals who also require less training and are less expensive to train and who simply cost the system less and are absolutely appropriate and essential to our system. In no other industry I'm aware of will a business use the most expensive resource to produce something, a product or a service, when less expensive and appropriate resources are available. We do that regularly. We need to get the mix right, and we can look to other health systems that are less reliant on physicians. Thankfully, the Canadian Institute of Health Information and its focus on workforce planning is encouraging here. This isn't to reduce or minimize the power of any category, but we have an inappropriate mix of health human resources across Canada. To do that, we're going to have to reconceptualize our payment and employment models, a discussion that would take far longer than 7 minutes. But at a minimum, we should be focusing on the value we get for healthcare spending, a focus of our work here at the school, and not just the amount we spend. We spend plenty in Canada, just on the wrong stuff often. Speaking further of payment models and incentives, we need to make it financially attractive to invest in redundancy. We can't demonize the private sector and for-profit motive when all is calm and good, and then lean on them in times of crisis. We saw wonderful examples with our creative destruction lab here, bringing the private sector and inventors together during COVID to set up thousands of testing sites. And this allowed private companies to stay in business and keep our economy going. We, of course, have a siloed system. As a former American, I naively came to Canada thinking, coordination should be easy in a single-payer system. I was surprised. We're starting to make considerable advances around digital connectivity, and we need to continue investing mightily in that, and again, equivalent to peer countries. Also, our playbooks and our processes and protocols need to be developed and regularly updated, not just for institutions. Lastly, partnerships and supply chain. I'm no expert on supply chains, but many of my colleagues here are. This is going to be a really interesting time for supply chains around the world. There will be, given the events south of the border, many walls built by the US, including trade walls. And these will change the nature of supply chain landscape. From a resilience perspective, that could be good for Canada if we take this opportunity to diversify our resilience away from the US. But I'm actually nervous about that for the US and their supply chains. And when they suffer, the entire world economy suffers. So what can we do? I was recently reading about the French Revolution and recently had some conversations with health system leaders in China and Saudi, and these stories are related. Big changes were growing or based on anticipated or real mass dissatisfaction. In China and Saudi, regardless of what you think of their regimes, they are making incredible investments in their systems and are forward-looking. We need to move away from our cult of efficiency and support our government leaders and, in fact, demand investments from them, investments in Slack resources, more training, and to mix my metaphors, cut those policymakers some slack when they overinvest. That's what resilience requires. If we don't do it, the world will rightly sell Canada short. Thank you.